Hi, and welcome to this Firehouse Quick Chat. I'm Peter Matthews, the editor of Firehouse, and I'd like to introduce Bill Gardner from ESO. Chief, thank you for joining us today, and we appreciate you filling us in on some of the information about ESO and data in the fire service. Before we get into what data is, Bill, can you tell us about your fire service background as well as ESO and the solutions that you provide for the fire service?
Absolutely. Thank you, Peter. Uh, I have had the great opportunity. I've had 35 plus years working in public safety, starting out with as a kid, as a volunteer in a very rural area
Okay.
of Texas, and then working through that opportunity to be blessed to make this a career. I've had the opportunity to work both fire and EMS, as all of us do along our career path. Every once in a while, we slip over that line. So I've dealt a little bit with the other side of that,
Yeah.
that blue line. But focused all of my career in fire and EMS, had the opportunity to do some different great things and worked from that small environment all the way to working in EMS in a large urban environment, a
Okay.
metro, and then coming back into a suburban one of those metros, which was one of the fastest growing cities in the U.S. for 4 years in a row, where I got to be the great pleasure of being the fire chief there and helping that organization grow and helping build. It's good to be on the upswing when you're building 1 to 2 stations a year and
Yeah.
buying trucks and looking to hire great people. So I've had a very blessed career and had the opportunity to be involved in that, be involved as serving as past president for the state of Texas for the State Firemen and Fire Marshals Association there, to those firefighters and great people there, and then also working with incident management teams and the Lone Star team and getting to travel across the country. So it's been great. Ended up about a year and a half ago being transitioned into the private sector and coming to work for ESO because they had the same mission. They wanted to improve communities' health and safety, and instead of doing it with a big red truck and a bunch of great guys and gals, we do it with data. And so that's how I ended up here.
Okay. And then so data, I mean that's something is we'll talk a little bit more about it. So ESO, as far as collecting data, what are some of the products that ESO offers when it comes to data? So as we look at data and how you manipulate, or not manipulate, sorry, use it in the fire service, what kind of solutions does ESO offer?
ESO has a great span of what we do with our tools and our product line, and available to collect data at the point of the most accuracy from the responders, all the way through from collecting both our fire incident data, our data around patient care,
Okay.
the ability to collect that data and move that data also into properties and inspections in the day, our community risk reduction tools that we use around our activities, scheduling and keeping track of your personnel, training and tracking all of the personnel associated with that, also keeping up with just your daily calendar, your task. All of those things have data points, and all of them should have the ability to collect those points and know what's going on. I always laughed and as a chief, fighting the perception of, well, your guys are sitting around, they're not doing anything all the time because there's not something on fire all the time.
Yeah.
And the ability that we have at ESO is to create the ability to actually show this is what goes on in the fire service, between the changes that have been pushed at us for the increased training, providing, preparing and planning and reducing risk associated to our communities. All of those things are real. All of those things are needed, and the ability to collect that and show it accurately,
Yeah.
and use that tool is what we do at ESO. We do it well.
That's great. That's a great service. And on the heels of COVID, right, with the pandemic, unfortunately, a lot of data was used across the board, whether it was in DC, whether it was with the health departments, with the local hospitals. Data became huge in this past couple of months, but also with the recent Center for Public Safety Excellence report, where they really focus on data kind of driving the future of the fire service and everything from staffing to budgets to deployments of various resources, like you mentioned, right? Community risk reduction. So data, it's a very short word, but it's a big buzzword. So can you tell us what exactly data is? What are the data sets and points that you mentioned earlier? And then how do you collect them?
So I think there's some interesting pieces with all of those things you talked about there real quick, Peter. Data is just information. And it needs to be factual information. It is how you take that data and how easy it is to look at that data and to do something with it. I can have all this data in the world, but if somebody's going to tell me how I can report on that data, or if somebody's going to keep that data and I don't have that ability to report on it, then I'm struggling, because I need to take that, it needs to be applied, and it needs to be actionable. And that's a huge piece of what needs to happen with that. We talk about, just like you mentioned with COVID, during the early stages of COVID, the ability to track PPE use, the ability to know if it was initial use or reuse and how those things happen. You know, there were several of the federal agencies that came to point to asking those questions and trying to track that. We were very fortunate that we were early implementation in our product line across prior to even the U.S. Fire Administration's reports. We were able to track PPE, when it was used, was there a potential for a COVID exposure, who was it exposed to, how do we track that personnel, how do we track them on the schedule to know when it's okay for them to be at work, when it's not okay to be at work. The ability to capture and track data on even people checking in. Did they have a fever? Did they feel bad? And making that part of their routine and easily able to check with things we did. And we did that early on. And we did it to a point where we worked with the industry and provided those data reports, both the states and at times actually working with the federal government to get a hand on how much PPE is being used and how many COVID impressions are really being admitted into the hospital. And then how many of those first responder agencies call volume was impacted because people quit calling 911. But the call volume wasn't necessarily reflective of the amount of time, because it took longer to run some of those calls because of the PPE and the severity. So providing some of those things. We all know during this time, there was a lot of discussion about the concept of government public safety. What are the perceptions of what should be done? And it came out with the Center for Public Safety Excellence paper that they worked with the International City Managers Association on what is a fire department. You know, a fire department and the perception of what a fire department was 35 years ago when I entered this business compared to today is totally separate. The perception of people of what they expect from a fire department is totally different today. 35 years ago, you may have had some EMS, you may have had some first response, you may have had some of those things. You know, you also may or may not have had some hazmat. You may or may have not had some technical rescue. It is an expectation today that those things are provided in a community and they're done. And if, when in doubt, the fire department should do it. But you should do it responsibly, and you should do it because there's an expectation defined by the community and how it's done. And justify that. And there's where the data comes in. One of the things that governments are faced with more today than any other time is accountability for dollars spent and justification for people. One of the things that recently was talked about in some negative light was the ability for people to justify why they need to have people present. Is it not cheaper just to pay a lot of insurance claims out? And walking through that and having people actually walk through and have to justify, this is why we are here. And this is what we're doing during this time. And here's the impact when they're not present, was crucial. And that's an item that I think we're going to see more of. I think we're going to see more requests for justification of what we do in public safety and what we do in our community impact. We know that today the citizens expect an impact, not just from response, but an impact in a social economic reportable fashion of this is what we do to make the economy work. This is what we do to help all different social aspects. And this is how we're in every different part of the community. And you got to be able to justify and do that. And that was called out by some of the requests out of the ICMA report that we're seeing. And quite honestly, if you watch the news every day, it's being called out today.
Yes, yeah. Yeah, it's the accountability aspect of it. And again, you know, the fire department is just, it's a title at this point, right? And really, with all the other services that are being provided, it's not just rolling out on structure fires, vehicle fires, it's accidents, it's helping folks in the community get something done. You know, it's going into the schools, those community touch points beyond emergency calls, right? And I think so much of the fire service has been accustomed to the worst day, but now it's every day.
Every day.
And even from the career side to the volunteer side, you know, even on the volunteer side, they're getting called out for what would be considered a non-emergency, but the community's still expecting it, right? They pay their taxes or they pay their fees, and they're expecting the fire service to show. But why should the fire service get trained and educated on certain topics? I mean, it's phenomenal. It's just a really interesting topic to look at, and with accountability being held so high from the public, from the city or the community managers, it's critical at this point. It's really mission critical to get an understanding of what services and how much time is being spent and the resources being spent on public service.
I think what service is being spent is a really interesting point, Peter, with the activity of the suburban communities growing from both people leaving the urban environment and rural environment coming together and seeing that growth. Those expectations from those folks leaving the urban environment is one thing. Expectation of those folks from the rural environment coming in and having new service delivery that is not necessarily always been there, and defining what that service should be.
Yeah.
You know, you talk about that, the worst day. Well, people are looking at this going, well, what is the worst day and what could that be? And how could we mitigate that from ever happening? And more importantly, how could we get additional resources?
Yeah.
Data should be used to drive what service model you're using, what services you're delivering. And that's how you move your organization forward. Yes. I understand for 20 years we've done this, but moving forward, we need to start looking at doing this as a collective. It's better for the people that are doing it and the people we're serving.
So what data do you collect to tell the department's story, you know, internally to your members, so your members have buy-in for what it is that they're doing, right? Again, as their roles change from strictly firefighters to fire and EMS to community service providers or, you know, public service providers, what data do you need to address that change and transition for them? And then how do you take that data and also get your taxpayers to understand why you need a new station or you need a new apparatus, right? I mean, you mentioned it, you live in Texas, I live in Texas. That's the only place where I see fire stations going up repeatedly is because so many folks are moving there and they're realizing from the onset that, hey, if we go to this is our master plan, we're going to need X amount of stations, apparatus, personnel. And it's happening, but so many other parts of the country are growing and they're actually losing personnel. So what's the data that we need for that?
I think it's telling their story. And we have to get better as an industry at telling our story. Somebody's going to tell our story. We as an agency can tell our story, or somebody that may not like us can tell our story, or the investigative reporter can go tell our story. But somebody's going to tell the story of your agency. Mm-hmm. It should be us. And we don't always embrace that as well as we should. But we need to collect that data. A couple of things in the data that needs to be there is not just black and white. This is how many calls we ran. That's great, but what does that mean? The ability to show the impact to your community also shows value. If the community knows that you went out and you touched this many different lives and made them better, or by your prevention efforts, you did this many different styles of inspections and did it better, all of those things add value.
Okay.
I think part of what we need when you collect data about telling your story is, remember, you're not going to tell the story the same way to every person. Telling the story to your elected body is a precise, this is the value, this is the economic impact, and this is why you get a return on your investment story. And that's looking at what your save loss is on fire. That is looking at your calls, but how many people did you impact in those calls? Not just I ran 20 calls, but I ran 20 calls and we had, 17 different patients, and out of those patients, all 15 of them got discharged from the hospital. 2 of them got sent to a care facility, and 1 didn't make it. And out of the other 3 calls, we got canceled. But we didn't just get canceled. We were able to make sure that someone got referred to a community health program or a different program. So the ability to provide that data is significant. Also, remembering the workforce today also wants a story. They want to know that I'm coming in, I'm spending my 12s or my 24s or my 48s, whatever that schedule is, and I want to know that I'm making a difference. They want to know that their performance is good. So you want to collect data around that unit, that station that says, hey, here's are the performance indicators, and here's the graph and the display that you guys are getting to see, showing what you're doing every day, that you're going out the door, you're hitting those marks. From the time that the alarm sounds to you're in the truck, 45 seconds, y'all are great. And then they want to know, hey, out of this many people we saw, this was the outcomes for them, and this is the difference we made. Or we know that we have 10 times a year, we have infant fatalities because of improperly installed car seats.
Okay.
And we're going out here on these car wrecks. Why don't we start doing something about it? And then implementing those programs. Using data makes a difference to the internal customer. Your people that you're working, they want to make a difference. Show them they're making a difference. You invest in them to show them you're making a difference, you're going to keep those high-speed, low-drag people. You're going to get the people we want. Mm-hmm. The other part of it is your data needs to be able to tell a story wherever you are in your community. The ability to look at your community and say, you know what, in this zip code, in this neighborhood, in this area, this is what we do. This is the difference we make. And this is what we're coming in and doing. The local community wants to know. And if you make it personal to them, they'll repeat your story for you.
Yes, great point.
And that's where the value comes in. So collecting the data about what you do from the time you walk into that shift, all of the maintenance checks you do, the training you do, all of the involvement you have in the community, on top of all your incidents, on top of all the training to show you're qualified, that it's not, how many years were we told that firefighting was just about how tough we were? Could we just lift something heavy? Man, those days are gone. We have to be physically fit for our own wellness, because we have too many of our brothers and sisters that become ill and become sick. But we have to be able to show why we're doing these things.
Yeah.
And then that investment in your people, number one things they want to know, what are you doing to help me? There's 2 or 3 things that could kill me on my job. Somebody that's not watching what I'm doing and providing good leadership, exposure to bad things that cause me to have problems. What are you doing to track and report that? And what are you doing to make sure that I'm safe with all my equipment, my apparatus? If you track those, document those things, people are going to buy into that.
Yeah. And
people are going to say, you're making a difference with that, and they're going to continue to fund those things to happen.
That's great. That's an excellent way to look at it. And I think you touched on well, you had your 3 points there. And again, it's for the members internally, the exposures, right? That's huge right now with cancer and even with COVID, like you mentioned earlier. So you have the ability to track those exposures, short term and long term, and the overall impact on a firefighter's career, their long term health and well being, and even with everything going on now related to the focus of mental health and wellness in the fire service. Again, tracking those calls, right? Some people can bury that away and it'll never come out, and you don't know what's going to be the trigger. And then there's also the folks who aren't able to necessarily bury that away, and that's having a long-term effect. I mean, you look at the numbers over the last few years, and it's tragic, and there's something that needs to be done. And if you start to collect the stat and you really look at it, and how many of these folks responded to this many types of a certain type of incident, that can really help you look at your members and what they're going to need resource-wise, short-term and long-term.
We were able, during my tenure as chief, we were able to look at critical incident in a retro study and found out that we needed to do some things. And what we were able to do is look at our schedule and using the schedule that people were working and seeing all of a sudden these trends in sick call and start going back and looking at reports. Well, what we've done in our ESO software is you can identify critical incidents now. The person can identify the critical incident themselves.
Okay.
If they pick that, you can set that up where a trigger goes out to a peer support. Administration doesn't have to be involved. Okay. It's a peer-to-peer item. If you have a clinical wellness team that is involved in mental health and mental support and behavioral concerns, it can go to them. And that's all automated. It's kind of like the silent screen. And it's part of why they're doing the report. Don't make it another step. Make it part of what's happening. Same thing with the cancer exposures that we were talking about. We have the ability to track that while they're doing the report. It's in the fire incident report. What were you exposed to? What PPE were you using? How was it all done? They don't have to log out and go somewhere else. They don't have to worry about it. And it attaches back to their personnel file for the long term. Okay. Because they may not need that claim, as you and I both know, for 8 years. Now they have that because it's attached there. We're also working with the different groups. One of the groups happens to be the National Firefighter Registry, to where we're going to start importing that data over to them because we feel like it's important. If our customers want that data in there, let's create that data. Let's create that database. Let's help do that research. So all of those things are part of the daily activity. And I think that's the key, is to collect the data. And we talked about getting it at the point of accuracy and doing it in there. There's a lot of programs that will allow a lot of different information. And there's some great tools out there. There's some neat things. Over the years, I've seen a lot of neat things. The one thing I know is the more that I put it all into the single platform, the greater chance it's going to get used.
Yes. Yeah. Yeah, you're not looking through folders and files and trying to associate everything back. So you mentioned it goes into a personnel file, especially the exposures and that kind of stuff. So is there within the ESO platform, is there a record for each member of the crew and all that kind of gets funneled in so you can everything they do?
Absolutely, Peter. One of the things, so when they fill out that fire incident report, that unit that had the exposure, that person gets and puts that exposure in. And the exposures may be different for each person. The entry team off of an engine company may have had one exposure while the pump operator had a different or not. It varies. We all know that. So it creates that. But that record, once that exposure is created, automatically sends that information to that person's personnel file in their health side. So it's protected. Not everybody in the organization can see it, but the right people can see it. But more importantly, it also attaches to that incident. So if you ever have to come back and go through that process of saying, I had the exposure and here was the incident, you can justify and help do that for each other in the service. Same thing with critical incidents. And the same thing that you would work through in each one of those pieces. if we don't take care of ourselves, then it's bad on us.
Yeah.
And I think there's a stronger cultural desire to do that than ever before. And this is a good way to do it.
So, and again, tying it back in, that's giving you the reason for the buy-in, right? I mean, so internally, it's not necessarily Big Brother watching you. It's literally giving you long-term support so you can enjoy your career and then enjoy your post-career time, knowing full well that this is everything that you've encountered throughout your career in the fire service.
Correct.
So, okay. All right. So Bill, how can we learn more about ESO and what you have to offer? Website, folks they can contact, and what do you suggest folks who are interested in learning more about ESO, what do you suggest they ask so they get the solutions they need from you?
I think there's a couple of things. Always, you can go to our ESO website at eso.com, go in and look at that and find out a lot of things. But off of that website, there's some training and informational videos and clips talking about why you need to have a records management system that does certain things. I will tell you, there's salespeople for every different program out there.
Yeah.
I think the thing that helps us is every one of our people, from our executives and our senior directors, have been in the industry.
Okay.
The CEO, I know he was in the industry because I rode on an ambulance with him years ago. And I seen him. I seen him run calls. So he gets that. I've seen him at 3 o'clock in the morning trying to figure out what that drip rate was. I got that.
Do you have that as part of the solution?
Yeah, that's it, brother. That's it. Yeah. So we get those things, and we get the value. But more importantly, we get the understanding that you've got to put that information in so we can get those things back out. So watch the videos that are there, because you need to ask those questions about what is it your organization needs in the way of a records management system. And you need a records management system that's going to be a partner. Anybody will collect data and will send in to U.S. Fire Administration or your state fire marshal's office your basic reporting.
Mm-hmm.
What is it you need it to do beyond that is where the question comes in. And more importantly, how do you use that to make things better in your world?
And so does ISO provide that? You know, again, is I'm going to say a data analyst, right? Is that something that's automatic? Like you can literally just pick the data sets that you need and export the report. How do they pull that or export that from?
Yeah. So one of the things that we're really proud of is we have some analytic tools.
Okay.
That are automatically part of the program.
Great. Okay.
That you get when you buy that. The other part of it is I can't always project what you're going to want to look at. So we have what is called a tool in there that provides a ability that if you're entering that data field in there, then you can pull that data field back out in a report through the tool. Okay. You don't have to go and build another software to do that. You can pull that out. You can export that out into a spreadsheet. You can export it out into a spreadsheet and add a graph to it if you're a graph person. Or you can export it out into a spreadsheet and do a comparative with that or a trend line. So those things are part of that. Mm-hmm. There's certain agencies that want to do business information tools that have analysts. And we work with those groups and allow them to pull that data out, and they pull it into export it, and they can load that into a FTP folder. They can download that and automatically set it up to where it comes to an email, and they're putting that into their BI tools because they want to do some other things. But all of that data is there to allow you the ability to create anywhere from mapping to your ability to do that reporting. Because I can't predict, trust me, 35 years ago, I didn't predict that I would be tracking PPE reuse on anything. Yeah. And we just spent months doing it. So I don't know what I don't know, but we do know if we put it in, we'll give you the ability to get it out and use it somehow.
Chief, that's great. That's really good insight into ESO. And again, it is a solution. And I think that's one thing that's really key as we're talking about that, is that output is creating a solution for your department moving forward in how it's going to provide service and what the next steps are. So I really appreciate you taking the time. Again, Chief Bill Gardner from ESO joining us today to talk about some of data. It's I think we don't have enough time for really what data is and what you can capture and how you share it. But I really appreciate the overview and recommend that you check out ESO.com for some more information on it. So, Chief, thank you so much.
Thanks, Peter. Take care. Everyone be safe.